Okay, wait. So maybe just like where you, like how you got to where you are, so like college and stuff.
Okay. What's our time frame? Till 4:15?
Yeah, bro.
Okay. Yeah, so I actually graduated here in '89. Which doesn't seem, it feels like yesterday, but I guess it's been about 30 years. But, so I graduated here in '89. I went to University of Virginia. Graduated in Virginia in '93. And I'll just tell you my path. And that is, I guess you could say I probably, in the early year or two of college, didn't take college as seriously as I probably should have, so I didn't do so well. But I finished very strong, but I did not get into medicine, and I knew I wanted to go into medicine. Even in high school, I think I knew. What grade is everybody?
Junior.
11.
9, 11, no seniors? Okay. So when you go to college, wherever you go, everybody that's applying to medical school, so you want to know about going into medical school, right?
Yeah.
So everybody's going to have great grades and pretty good scores. I mean, you got to have at least a minimum. And it's probably as competitive as ever, I think. But, so anyways, you go wherever you go to school for college. It doesn't have to be the best college. It's almost more important to go, it would be better to go to a regular college and have, perfect grades than to go to Harvard, Princeton, or Yale and have a B average. It'd be better to go to wherever, anywhere else, Georgia, anything. Does that make sense? Because you want to be able to stand out from everybody else. So everybody goes to, everybody that's applying to medical schools, is coming with outstanding grades and pretty darn good MCAT scores. And if you're not in that group, then you got to figure out a way to get yourself there. So that was actually me. So I thought that I was a pretty good candidate, in my early fourth year of college, because that's when you're applying for med school, summer after your third year into your fourth. And so while I was waiting to hear which medical school I was going to go into, I assumed I was going to get in. And when I didn't get in, that was pretty much a wake-up call to me. I had not wavered on what I wanted to do, and so I went to talk to different people at different medical schools and says, here's where I'm at. I had good grades in college, but I didn't have the best grades. I had like a 3.6 GPA or something, 3.5, 3.6. Good MCATs, not the greatest. And for medical schools, believe it or not, there are, I think even for colleges, so y'all are probably aware, like in Georgia, there's zip code quotas. They can't take everybody from Atlanta. They can take 50% from Atlanta, and then they got to get some people from Valdosta, and got to get some people from Columbus. It has to be geographically representative because it's a state school. Private schools don't have those requirements. But med school is the same. And so when I met with them, they said, you got to make better grades, you need to take some extra science classes, go do something else to distinguish yourself. I worked in a heart transplant lab at Emory, doing nothing important, but just being there. Applied again and got rejected again. So I'm like, what is going on? So I got rejected twice, had perfect grades. I went to Georgia State, took any science class I had not already taken. So I'd run out of science classes to take. So the next year, took more classes, 2 quarters, then it was quarters, I think they went semesters, but I took, anything, philosophy, history, anything that, whatever I could think of taking. Perfect grades, went back to that lab, got more active, definitely humiliated at this point. And I finally got into one medical school in the spring. That was the 3rd shot I got in. got rejected from 19 others, including Medical College of Georgia. There's only 2 medical schools. Well, there's Mercer Medical College of Georgia and Emory, and everywhere else rejected except Emory. And so, when I started medical school, you could say that I had a chip on my shoulder and a confidence that was rattled. And so, when I started medical school, I said, I'm going to show everybody or prove everybody wrong. And I did. I did extremely well in med school. Not the best. I wasn't the smartest guy by any means, just average smart,
Please
I think.
excuse the
But I worked
interruption.
extremely
All
hard.
participants in
And
the
did nothing
advisement
else, just
meeting
for medical school,
scheduled
it
for
was,
this
some people
afternoon
had the
are
mindset
welcome
where they
to
were
come
gonna,
to the
I was gonna
conference room
study
at this
4 hours a
time.
day, and
If
then I
you're
was gonna be done.
participating in
and
the
that
advisement
didn't
meetings
get me anywhere I
that
wanted
are
to go,
scheduled
then
this evening,
that's what,
you are
I didn't
invited
have
to
that
come
approach
to
at all.
the conference
My
room at
approach
this
was, I'm
time.
gonna try
Thank
to
you.
study the hardest more than anybody else, fully master the material, and I did. So I did really well in med school. I wasn't top 10%, I was 20% probably, but I did pretty well. And the way medical school is now, they've changed so many things. They don't even try to put too much of an emphasis on your grade performance. So they changed all the grading. Every medical school is different, which makes it very complicated. They went away from an A, B, C system to a pass-fail, but then they went to pass-fail and then honors pass and then high honors. So like high honors is an A, honors. So they still have some way to differentiate students, but everybody has a different scale. So when we look where we're at now, when we look for medical students into our residency programs, it's very hard to just differentiate people based on their grade performance in medical school, which unfortunately, what they were trying to do is to try to eliminate some of the competition among students in medical school. But what it really in fact did was put more emphasis on the standardized tests, like the board exams and stuff, the medical licensing exams. In medical school, you take 3. There's steps 1, 2, and 3. If you look at step 1 and 2 for residency programs. So, anyways, I got into general surgery. I wanted to stay at Emory because I was interested in cardiac surgery. Emory had a very strong cardiac surgery program. Jared's dad was there well before me. And that's what I wanted to do. So I stayed for cardiac surgery. It was 10 years. And so the way our pathway was then, after 4 years of medical school, if you wanted to do CT surgery, you went through 5 years of general surgery. Most of us did 2 years of research in between that time, where we left the residency program, went into somebody's research lab and learned about basic science research. Came back, finished general surgery, then 3 years of CT surgery training. So that was 10 years. So by the time I finished, because I was 2 years delayed in going to medical school, which for me was probably the best thing that could happen to me. I mean, I basically started my first real job when I was 38. So, that's a tough thing. If you were ever to go into something like this, because most of your friends that graduate college are starting their job when they're like 23, and they've been working and saving for retirement and accruing wealth or whatever you want to call it for like a 15-year head start. And so that really puts a lot of you're not having a lot of social time in your 20s and 30s like the rest of the world is. But you got to decide what you want to do, So, anyways, then I was, and then I've been there this is my 10th year out of training. And for us at Emory, the way things have specialized is everybody sort of goes into certain super specializations. So yes, I do adult cardiac surgery and I do kind of most of the spectrum, but there's certain areas that I focus on. Ed Chen focuses on aortic surgery. I have people that focus on transplant surgery. I have people that just do lungs and esophagus. Some people that do robotics, that's what I do. Other people do catheter-based work. So everybody in our group sort of really super specializes. So without going into too much detail about that, I guess the message is, And you don't have to do that in medicine. There is a huge spectrum of areas depending on what you're interested in. I would tell you, you have to, whether it's, going into medicine or anything else, if you are not 100% like passionate about it,
if you're available, please come to
miserable,
the media center for a parent meeting.
and
Thank
bored
you.
out of your mind. So you gotta be really interested in whatever that is, pediatrics, women's health, OBGYN, whatever. So, that's kind of that's my story. Yeah.
What made you decide you wanted to go into cardiology over, is it just your personal interest, or was there something that?
Yeah, well, so I'm in cardiac surgery, but my first interest was cardiology. Because in cardiology, the opportunities for specialization, they're even broader. You can do coronary, cathing and stents. You can do just imaging or general practice. Take care of people with high blood pressure, preventative cardiology, women's health, electrophysiology. There's 1,000 different areas. But you don't have to make those decisions, definitely not now, and you don't even have to make them in medical school. What you have to decide is sort of the basic disciplines. You need to decide surgery, medicine, obstetrics, pediatrics, like neurology, and then there's about 4 or 5 subspecialties that you do have to choose in medical school: orthopedics, urology, neurology, neurosurgery, and ear, nose, and throat. And that's it. And psychiatry is the other one. And you take those rotations, your third year of medical school, and then it's like 2 months max, and you get a little bit more clinical exposure early. There are a lot of schools are getting people engaged much earlier, so they have more time to think and make those decisions. And some people change their mind. Anesthesia is the other one. Some people change their mind, and it's not easy to deal with, but it's manageable. So when I was in my third year, I had the problem of everything I was doing I kind of really liked. So my first rotations were with obstetrics, and so I thought delivering babies was the most incredible thing in the world, and I thought I'm doing that. And then I did gynecology, and I said, no, I'm not going to do this. So then I did psychiatry, and I personally didn't really like that, and then I did surgery. And I remember exactly, it was one case, it was like 16 hours long, and somebody was bleeding to death, and I was just helping hold something so they could do what they were doing. And I said, that's what I'm going to do. That was it. And so right then I made the decision. It's not always that, clear cut, but you'll figure it out. Whatever matches your personality, your style. And then my fourth year, I watched a hope and a heart operation, and then right then I was like, I'm going to do that too. So I knew by the end of my medical school, but not at the beginning at all. You have no idea. Things change so much, you have no idea. And then there's work-life balance things and priorities and that kind of stuff. You figure it out when you're in your third year of medical school.
So I know you have to pay for med school and stuff like that. Like, how does that? Did you ever get a job while you were a student, or was it just kind of you wanted to wait till you actually had a job and then start paying off your debt?
Yeah, you can't do it. You cannot work to pay off. You cannot work during medical school and be a successful medical student. Definitely not.
Yeah.
So your options are to look at schools that are not expensive, like Medical College of Georgia. Now there's Augusta University too. They've changed their name a couple times. But the public schools are much less expensive. Much less expensive. And the private schools are extremely expensive. And even like Emory has a state requirement, so it requires 50% of their students come from the state. But what most people do is they just accrue debt. So you finish with 200 plus thousand. You own a home without owning a home before you're even done. I mean, it's $250,000 in debt, or you qualify for financial aid. But even with financial aid, you're still going to have a lot of debt. No doubt about it. Yep. There's a lot of debt. Now, you know how this is. Y'all are looking at colleges. I mean, you want to go to out-of-state University of Alabama, you're going to pay $50,000 a year. If you go to Georgia or anywhere else in Georgia, you can pay, what, $5,000 or something? Just no There's no comparison. So, and that starts for a lot of people in college. College never used to be $50,000 when I was, I was out of state of Virginia. I think it was $12,000 out of state. Now it's 50, maybe. It's just totally different.
And then with surgery and stuff and needles and stuff, were you ever did you ever have a weak stomach to that stuff, or did you
Never.
just get used to it?
No, if you walk in there and if you gross out, you're not going to want to do that. But you don't know until you see it, because everybody thinks surgery is just blood spilling out everywhere and guts. It's actually pretty clean, unless it's a bad surgeon. There shouldn't be blood all over the place, except maybe in his dad's cases. But but mostly not. Mostly it's clean and controlled. And I think it's beautiful and fascinating. It not once grossed me out.
So
Yeah.
obviously you're the chief. How was your transition from, do you do less surgery? What was your transition?
Yeah, I'm supposed to do less surgery. I might do a little bit less, but I probably need to do even less than I'm doing. Yeah, that's been a very hard transition for me. So all he's referring to is there's a hierarchy and leadership structure, and there's somebody's got with any large program, and Emory has a large program. We have surgeons at 8 different hospitals, and somebody's got to manage all of that. And one of the key things is, in my role, is having people that help me manage those things and sort of key allies in each place that can help kind of push my agenda or what I think is important, who share a common vision, who strive for excellence, who want, that's what I want. And I should operate probably 1 day less than I currently do, which is 4 days a week. I really should be 3 days. Because you have to be, and this is a lesson in, I hate to say the business piece of healthcare, but that's what it is. I mean, it's not like it used to be where you kind of just did your thing and everything was nice and smooth. I mean, there's incredible financial pressures on healthcare organizations to try to keep costs under control, but provide top-level care with as little resources as possible. There's not just money flying around, just kind of do whatever you want to do. Everything's being pinched, not to make life miserable, but to make it as affordable and practical as possible, because it's been out of control for years. So for me, balancing those administrative roles, it's almost like I guess an analogy would be whoever the principal is here. Bugles, I guess the front of the row is named Tom Bugles. That was my principal. I actually did his heart surgery. So, anyways, it's analogous to your principal actually being a teacher, but trying to keep the same teaching role without taking care of the front office, and that's been very hard for me because I love surgery. It's actually much more relaxing than the other stuff, which is managing people and dealing with administration, which there always are doctors. You have to have doctors to run hospitals and take care of patients, but there's also